Welcome back to The Full View. As many doctors and scientists call for stricter regulations due to the spread of COVID-19 in South Africa, we're asking whether the country can afford another hard lockdown. The debate around lives versus livelihoods still rages. After the first lockdown, it was announced that 2.2 million South Africans had lost their jobs, and the unemployment rate has spiked since. On the health front, the situation in many hospitals is dire, and yesterday the country breached the 1 million mark in terms of the total number of COVID-19 cases. To discuss all the hard options here, we're joined by economist and the director of the Centre for Economic Development, Duma Gqubule. Duma, thank you for being with us. The deaths are just awful, and we were talking to someone earlier saying in Gauteng we could see double the number of infections, therefore double the number of deaths. But the possibility of families with not one breadwinner also gives you chills. Just give us some insight into your thoughts ahead of the President's address tonight.
First thing, Francis, I think first thing I have to say is that the President must acknowledge that we haven't had a successful COVID response. It's actually been a failed COVID response. We're talking about 1 million infections, number one. We're talking about 27,000 deaths. And if you add excess deaths, we're probably talking about 80,000 South Africans who have passed away because of this virus. So the government should not convince itself that it has been successful in terms of this response. Now, I heard you talk about, and I think the President will be justified to announce some restrictions, for example, on travel, on parts of hospitality, and maybe some parts of alcohol. But I think there is no way South Africa should ever have another hard lockdown. The economic cost was huge. As you were saying, 2.2 million South Africans lost their jobs, and we lost all the jobs that had been created since December 2008. So between December 2008 and September 2020, the number of jobs in the economy has shrunk by about 100,000 jobs. And I think people shouldn't deliberately say we must just have another lockdown. It is not a joke. South Africans are suffering, and you're seeing the queues throughout the country with people queuing for that SRD grant. Is the government going to provide economic support? Our support from the last lockdown was completely inadequate with the 350 COVID SRD grant. The government cannot shut the economy down again, but it can announce some restrictions to control the spread of the virus.
Yeah. So is there a way to be smart here? That's what you're saying with targeted regulations where, in effect, you are looking at lives and livelihoods?
First of all, I have to say, Francis, I think a lot of our discourse is based on the failed response in the West, where they've just completely and utterly failed to respond to this virus. But if we look to East Asia, countries like Japan, South Korea, Taiwan, and so forth, those countries showed how to save lives and save livelihoods. The deaths from COVID are much lower in South Korea, in Japan, and Taiwan. So they managed to achieve the best of both worlds. And they did not have hard lockdowns. They have implemented alternative public health measures that have kept the deaths in South Korea. I think the last time I looked, it was only 600 people had died from the virus, and it's a country with the same population as South Africa. But in South Africa, the failure we made was to develop a proper test and trace policies. These are policies that are implemented after people get infected, because remember, no matter how much people comply, there will be people who get infected. Now, what happens in the Asian countries, they go and test, they have rapid testing where results come quickly. And the second thing, they have contact tracing where they trace the contacts of all the people that you've been in when you were in, since you were infected, and they test all those people, and they extract the pool of circulating infected people from the population. They have quarantine centers in some countries. In Taiwan, people get paid to isolate. In Australia, they've got quarantine centers. In Ethiopia as well, they've got a lot of quarantine centers. But in terms of our response, I've not heard the government. We announced a stimulus package recently. I've not seen the government employ public health workers to assist people with the response to this crisis. And I think that is a big omission from the government. They should have announced tens of thousands of public health workers who are going to be involved in contact tracing and helping people to comply and public education and so forth.
Yeah. Well, I'm glad you bring up the stimulus package, or initially it was the rescue package of 500 billion, one of the big ones in the world. I think you were critical about how that money was spent, though. And I mean, now surely government doesn't have much room to maneuver. The finance minister has said they cannot even afford to continue that grant for the unemployed, that 350 rand.
The first thing I have to say, Francis, is that the government must stop talking about a 500 billion rand stimulus package. It was not 500 billion. The 200 billion was supposed to be the loan guarantee scheme, and the banks had only lent 17 billion the last time I looked, of the 200 billion. So the 17 billion, 75% of that 17 billion went to white businesses. So what happened is that the banks used a state guarantee to shift loans towards prime clients, most of whom are white. So these are people who would have got the loans whether there was COVID or not. So I don't count it as part of the stimulus. The government response was an increase in non-interest expenditure of 36 billion rands, and the UIF paid 52 billion rands to millions of South Africans who were temporarily employed. So the stimulus was, according to my calculations, about 86 or 87 billion rands, and it was far less than the expected shock to the economy of about 8 to 10% that was expected.
Yeah. And there is research agreeing with what you're saying, that a lot of small businesses that needed the funds simply couldn't access them. So let's talk about small business. I mean, would you support government shutting down on-site consumption, say, of alcohol? Then you reduce sort of the trauma cases in hospitals. But earlier, in the first lockdown, restaurants said that was killing them.
You know, Francis, we cannot shut down sections. We should shut down certain sections of the economy. We can operate based on what's happening in other countries with a 90% of the economy open. But there must be financial support to the people who are affected, like the 10% that will remain shut. I'm talking about the sections of the hospitality. And the big mistake we made, you know, in Italy, they cancelled rent. So if you talk to the restaurants out there, the real problem that they had was paying rentals, which have accumulated. And if we had just cancelled all rental payments throughout as part of the state of disaster, I think that would have provided a lot of support to these companies in the hospitality industry. But you can't shut down hospitality industry without providing financial support. And the financial support, there were bureaucratic impediments to accessing it, and it was totally inadequate. So I do think that we have to consider targeted restrictions and targeted financial support to the people who will be affected. Yeah. Because it is quite frankly irresponsible to shut down these businesses without giving them any support. Yeah.
But if the financial support didn't work the first time around, as you say, what will make it different this time around for the tourism industry that was just recovering, even hammered by the beach closures the other day, for example?
Yes, you see, I think the government put a lot of trust that the banks would do. They would listen to the president's pleading, and the government must provide direct financial support, as happens in other countries, towards these companies that will be affected and the people who may have to lose their jobs because of the restrictions that will be announced.
Give us an overall picture here. This new variant causing concern, the picture has deteriorated very quickly in recent days. We already expected this massive contraction of the economy in 2020. What are you expecting? And then 2021, there was some hope things would get better. But now, does that all change?
Yes, now what is happening now is a huge uncertainty as to the recovery that the president is talking about. In fact, the recovery was announced 2 months ago, and I think with this recent, or I call it a surge, another surge, is that the recovery is completely uncertain for 2021. Now, what we're seeing is that the government hasn't really showed up in terms of giving us a plan towards these vaccines. We saw at the weekend, Mexico, Costa Rica and Chile started giving the people vaccines. And we haven't really, the president should be telling us when can South Africans expect to have this vaccine? Because the COVAX facility, it will initially provide, I think, 3% of the population and 10% of the population. So we could have vaccinations for the whole population probably sometime in 2022. But there can't be any recovery for this economy while we have these intermittent lockdowns, where the government is failing to control the virus, and where the numbers go up, then they come down, and then next thing in March again, there's a surge and then lockdown. So we can't live throughout 2021 with all these intermittent restrictions being shut and opened again. So I need to hear a plan from the government as to how they're going to. It is actually incredible that the government couldn't pay for the first installment, and the government ended up begging private companies to make contributions towards this towards the vaccine payment. It's really wrong, Francis.
Yeah. All right, like many economists warning against a very strict, hard lockdown ahead of the president's speech tonight. That was economist and the director of the Centre for Economic Development, Duma Gqubule. Now, the Tlotla Molao law enforcement campaign in the northwest